Once you have established the casualty is in fact choking, your first action should be to calm and reassure the casualty and encourage them to cough. If this is not successful, then you should stand behind the casualty, lean them slightly forward, supporting their upper chest with either one hand or your arm across their chest, and give sharp back blows between their shoulder blades. These back blows should be attempted on 5 occasions. Check the mouth and remove any obstruction. If your back blows were unsuccessful, then you should attempt to give 5 abdominal thrusts. Again, stand behind the casualty and place both arms around them, leaning the casualty forward. Place one fist just below the breastbone and cup the fist with the other hand, as shown on the video. Then pull sharply inwards and upwards to try and force the obstruction out. Again, you should make 5 attempts with abdominal thrusts to remove the obstruction. If this is unsuccessful, you should repeat the cycle of back blows and abdominal thrusts. And if after 3 cycles the obstruction is not cleared, you should then call 999. With the choking baby, you should hold the baby in a similar position as a recovery position by supporting the baby with their head pointing downwards. As with an adult or child, you should first attempt 5 back blows. If this is not successful, turn the baby over and attempt 5 chest thrusts. If this is also unsuccessful, you should repeat the cycle of 5 back blows and 5 chest thrusts. And once again, if the object or obstruction has not become clear after 3 cycles, then call the emergency services.